Leader pal is the medicine you can see in the picture. Each part of the leader pal were used in the preparation of medicine, means whole plant of the leader pal is used in the preparation of medicine. But this medicine is belonging to the class 3. How you will remember? How you will remember that this medicine is prepared under class 3? Just try to remember 3 words starting of the leadum. 3 words LED. LED घर में हमारे होता है. Just try to remember LED. If you are talking about the LED, then we should remember the 3 words of leadum. Okay, L is the first, and E for the second, and D for the third. Means this medicine is prepared under class 3, and this medicine is commonly known as Mars tea, and which is also known as wild rosemary. And another name is Mars cistus. Another name is Labrador tea. And this medicine is proved by Dr. Christian Frederick Samuel Hahnemann. And Dr. Christian Frederick Samuel Hahnemann has proved so many medicine, like aconite is there, ambraxacia is there, sorinum is there, etc. So let's talk about the symptoms of leadum pal. Adopted to the rheumatic gouty diathesis, means those person who are having rheumatism or gouty diathesis. What do you mean by diathesis? Diathesis means what? Means diathesis is a condition where recurrent or repeated occurring of the disease, like a person is having tendency to develop a particular disease. Like if the patient is coming to you and he is saying that, Doctor Saab, मुझे stone हुआ था. I was having a stone and I took few medicine, I got cured. But after few times or after few months, again I developed renal stone. Means कुछ दिनों बाद again उसको renal stone हो गया. That condition is known as diathesis, means tendency to develop a same disease condition after few months. And those person, okay, so I was talking about diathesis. Diathesis means tendency to develop a disease after getting cured again, means after few months again he will develop a same type of disease condition after few months. That condition is known as diathesis. And this medicine is especially suited to those type of person who was having or habituated to drinking of alcohol. Means those patient, वो patient जो काफी दिनों से अगर alcohol ले रहे हैं, in the past history he was having alcohol drinking and they have developed rheumatism and gouty diathesis or gouty complaint, then we can think of this medicine. You can see in the picture, if there is a rheumatism, then what are the investigation we will suggest to the patient? There are 3 investigation we will suggest to the patient, especially those who are having rheumatism or RA. First, RA factor. The second is anti-CSP antibody, and the third one is C-reactive protein. But in case of gouty, what are the investigation we will suggest? We will ask for the patient to do a urine examination or uric acid. Another symptoms, contusion of eyes and lids, especially if much extravasation of blood, ecchymosis of lids and conjunctiva. So you can see in the picture there is a contusion. Contusion means what? Means if the person or if the patient got injury over the affected area. So there is no extravasation means there is bleeding from the arteries, means there is a leakage of blood from the arteries and arterioles. But what do you mean by ecchymosis? Ecchymosis means there is a bleeding which is underneath, means under the skin, but which is not coming out externally. And this blood is accumulated under the skin due to the injury. And here we can correlate with the or compare with the euphrasia. In case of euphrasia, there is also mentioned bad effect of fall and contusion over the eyes, injury to the eyes. If the person fall on the ground and is having injury, then we can think of euphrasia. But when we will think of lead and pal, when there is injury and there is extravasation of blood and ecchymosis is there, but the color of injury looks like a black blue which is turning into the green, then we can think of lead and pal. But again here we can compare with the symphytum. In case of symphytum, there is a irritation of the affected area where the patient got injury, especially into the eyeball or orbit or hit by the ball over the eyes or thrust by the babies, especially those ladies who are nursing her child. जो मदर अपने बच्चे को दूध पिलाती है, बच्चा कभी कभी आंखों में मार देता है, फिश से थर्स्ट कर देता है, जिसकी वजह से इंजुरी अगर होता है, देन वी कैन थिंक ऑफ symphytum of snails. Another symptoms, rheumatism or gout, begins in the lower extremities and ascends. Means if we will talk about the complaint of lead and pal, always starting from the feet and going upwards, travel to the upwards, means starting from the feet and going up to the shoulder, then we can think of lead and pal. But if the complaint is starting from the upward and going to downwards, means descending type of pain is there, then the medicine is calmia latifolia. अगर ऊपर से पेन स्टार्ट होकर नीचे की तरफ जा रहा है, देन वी कैन थिंक ऑफ कैल्मिया. और नीचे से अगर स्टार्ट होकर एल फॉर लोअर होता है, लीडम फॉल को याद करने के लिए एल फॉर लीडम, एल फॉर लोअर, मीन्स पेन बिगनिंग इन द लोअर एंड गोइंग टू अपवर्ड. आपका भी कंफ्यूजन नहीं होगा. एल फॉर जस्ट याद रखो आप, एल फॉर लोअर and L for leadum, means pain beginning in the lower extremities and going upwards, then we can think of lead and pal. But अगर ऊपर से पेन स्टार्ट होता है शोल्डर में and going downwards, then the medicine is calmia latifolia. And both medicine is belonging to the same family. That family is known as Ericaceae. Ericaceae, this family known as, and especially if brought up to the low asthenic condition by abuse of colchicum. In the previous time, colchicine were using by the people, and due to that there is a weakness, a low immunity, a low constitution, and those persons who were taking colchicine in the previous time, they will be having a seat of nodositis. What do you mean by seat of nodositis? Means अगर joints का problem होता है, either RA हो या OA हो, there will be formation of osteocytes. A tubercle-like growth will be there, and that is known as gout stone. Stones we will find in case of gouty problem, especially over the ball of great toe. Why? Because there is accumulation of a uric acid, and that point is very sensitive or very painful. And this complaint is very painful, which may be acute or chronic. You can see in the picture. If we are seeing in the picture, there is a deformity in the fingers. जो फिंगर्स में डिफॉर्मिटी है, एक्सरे वाले पिक्चर में आप देख लो या ऊपर वाले पिक्चर में, देयर इज अ डिफॉर्मिटीज. और डिफॉर्मिटीज का नाम होता है, क्या नाम होता है? दो नाम होते हैं. फर्स्ट बुटोनियर डिफॉर्मिटी इज देयर, नेम होते हैं, एंड द सेकेंड वन इज स्वान नेक डिफॉर्मिटी. वी विल ऑलवेज फाइंड स्वान नेक डिफॉर्मिटी. अनदर इज जेड नेक डिफॉर्मिटी. This is the question asked by the interviewers when I went for the interview examination. Interviewer asked to me, जब मेरा यूपीएससी का एग्जाम था, इंटरव्यू स्पेशली, उसमें यह क्वेश्चन पूछा गया था मेरे से. क्या पूछा गया था कि डॉक्टर साहब आप जानते हो, डू यू नो अबाउट द आरए? देन आई सेड यस सर, आई नो. देन ही सेड कि व्हाट इज दैट? देन आई सेड कि रूमेटिक अर्थराइटिस. देन ही आस्क्ड क्या क्या इन्वेस्टिगेशन करेंगे? देन आई रिप्लाइड कि सर एंटीसीपी एंटीबॉडी, आरए फैक्टर एंड सी रिएक्टिव प्रोटीन. देन ही सेड कि अगर आपके पास कोई इन्वेस्टिगेशन नहीं होता है, देन हाउ यू विल रिकॉग्नाइज और हाउ यू विल डायग्नोस दिस इज द केस ऑफ आरए? देन आई सेड कि सर इनके फिंगर्स में डिफॉर्मिटी मिलते हैं जिनका नाम होता है स्वान नेक डिफॉर्मिटी, swan neck deformity, jade neck deformity, and Boutonier's deformity. Then he said, excellent. That was the answer which is given by me in the interview. So, आप लोग ऐसे याद रखना, इन द पिक्चर में आप लोग देख लो कि क्या डिफॉर्मिटी हो सकते हैं. प्रैक्टिस ऑफ मेडिसिन से मैंने कोरिलेट किया है यहाँ पे. Another symptoms, hemorrhage into the anterior chamber after the iridectomy. means there is a hemorrhage. Hemorrhage means what? Hemorrhage जहां भी हिम लग जाता है उसका मतलब ब्लड हो जाता है. रेज जहां भी लग गया है या रिया है, मीन्स discharge of blood especially into the anterior chamber of the eye. But when after the iridectomy, you can see in the picture, in the first picture you can see there is a incision over the cornea or iris, and that cutting and creating a hole. So there is a flow of normal fluid or blood. That procedure is known as iridectomy. Another symptoms affects left shoulder and right hip joint. Means if the patient is coming to you and he is saying, Dr. Saab, I am having pain in my left shoulder and associated with the pain in the right hip joint. मतलब लेफ्ट कंधे में अगर पेन होता है उसके साथ राइट हिप जॉइंट में पेन हो रहा है, देन वी कैन थिंक ऑफ लीडम पॉल. और भी मेडिसिन है. कैन एनिमल टेल मी कौन कौन सी मेडिसिन है? वेरी गुड, very good. There are 4 medicine. How you will remember? Just try to remember. We used to see as a slang language, that is Sala. You can remember Sala. S for Stamonium, A for Antiptat, and L for Leadenpal. Another A for Agaricus. What is mentioned in Agaricus? Complaints diagonally affect the left shoulder and right hip joint. But अगर opposite condition होता है, then what are the medicine? Means affecting to the right shoulder and associated with the pain in the left hip joint. Then what are the medicine? उसके लिए क्या क्या मेडिसिन है? अगर राइट शोल्डर इन्वॉल्व हो रहा है एंड लेफ्ट हिप ज्वाइंट, देन क्या क्या मेडिसिन है? One more is there, phosphorus is also there, okay, and sulfuric acid and phosphorus is there and bromium is there, ambragresia is there and medorinum is also there. Okay, how you will remember? Just try to remember. SP BAM, SP, S for sulfuric acid, P for phosphorus, B for bromium, A for ambragresia and M for medorinum. These are the medicine. Another symptoms, emaciation of affected parts. Emaciation of affected parts. Here we can correlate or correlate with the practice of medicine. In some disease condition we will find there is emaciation, but there is few condition where is generalized emaciation, but there are few condition where is a emaciation especially of the affected part. तो दो चीजें हैं, एक में तो पूरी बॉडी दुबली हो जाती है, दूसरा होता है कि अफेक्टेड पार्ट, जनरली जो पार्ट्स होते हैं. तो अगर जनरलाइज्ड इमेसिएशन मींस इमेसिएशन ऑफ होल बॉडी इज देयर, देन द डिजीज कंडीशन इज प्रोटीन एनर्जी माइल न्यूट्रिशन. इसके वजह से दो बीमारियां होती हैं, वन इज मैरेस्मस, अनदर इज क्वासियोरकर. बट अगर इमेसिएशन ऑफ होल बॉडी है, उसके लिए मेट्रिया मेडिका में क्या क्या मेडिसिन होंगे? एब्रोटीनम, एस्टिक एसिड, आयोडम, tuberculinum, natramur and salicyla is there. These are the medicine where there is presence of emaciation of whole body. But अगर emaciation of affected parts है, then we can correlate with the some disease condition like atrophy of the parts, especially single parts. Atrophy का मतलब होता है like we have read in the second year, hypertrophy where there is an increased number of cell, and atrophy means a decreased number of cell, that is known as atrophy. Atrophy की वजह से emaciation हो सकता है affected parts पे, and दूसरा injury to the nerves. अगर nerves supply नहीं होगा तो भी क्या होगा? emaciation हो जाएगा उस parts का, उस muscle का. And another medicine is for the same symptoms. कौन सी मेडिसिन है, कोई बताएगा? इमेसिएशन ऑफ अफेक्टेड पार्ट्स. अनदर मेडिसिन इज वेरी गुड. बट what is mentioned in graphitis? There is mentioned suffering of emaciated parts. Okay, that line has been mentioned in graphitis, but same line is mentioned in selenium. But if there is a emaciation of cheek and back, then the medicine is, agar cheek and back tabacum. Very good, excellent. Another symptoms, pain or sticking, tearing, throbbing or rheumatic pains, which is aggravated by motion and aggravated at night and by warmth of bed and bed covering. These are the characters of pain, especially when the patient is having rheumatism and gout. But this pain is getting relieved by when the holding feet in ice water. This patient is getting relieved by when holding feet in ice water. But here we can correlate or compare with the brania. In case of brania, there is a pain, stitching like pain is there, and the patient is getting relief by while lying on the painful side. But in case of brania, motion is the characteristic symptoms of brania alba. Means any motion. Suppose if you are lying in the room and where the spider on the wall and the spider is moving on the wall, then aggravate the symptom. That is the characteristic symptoms of brania alba. मीन्स अगर वॉल पे अगर स्पाइडर भी मूव कर रहा है तो ब्रायनिया अल्बा का जो पेशेंट होगा उसका कंप्लेन एग्रवेट कर जाएगा. बट बहुत ही इंपॉर्टेंट लाइन है, स्पेशली इन केस ऑफ जॉइंट पेन, स्पेशली नी जॉइंट पेन, देयर विल बी स्वेलिंग, hotness will be there, and that swelling and hotness is there especially in knee joint of the brania patient, which is relieved by motion, where it is mentioned मोशन से आराम मिलता है. दिस इज मेंशन इन बोरिक मेटेरिया मेडिका. मोशन से सारे कंप्लेन एग्रीवेट होते हैं ब्रायनिया के, बट स्पेशली नी ज्वाइंट का जो कंप्लेन है ब्रायनिया का बोरिक मेटेरिया मेडिका में लिखा हुआ है कि मोशन से आराम मिलता है. But if the patient is getting relief by motion, then again we can compare with the rust toxicodendron. What is mentioned in rust toxicodendron? If there is a complaint from the spraining and straining, the patient is having aggravation from the first motion. फर्स्ट मोशन का मतलब क्या हुआ? जैसे बैठा है पेशेंट एंड उठ के चलना स्टार्ट करेगा, देन ही विल से, ओह डॉक्टर बाबू আমাকে ব্যথা হচ্ছে, means I am having pain. He will say like that. But after few minutes he will get relief, because in case of rust toxicodendron there is mention relief by continued motion. But here mention when holding feet in ice water the patient is getting relief. But can anyone tell me desire for cold icy water and ice cream, what are the medicine? कोई बताएगा आइसी वाटर और आइसक्रीम? वेरी गुड, वेरी गुड. pulsatilla, yeah, phosphorus is also there, and pulsatilla is there, okay, and valeriana is there. Creosote, in case of creosote there is a creosote में क्या मेंशन है? there is a menstrual complaint which is relieved by the cold drinks, not cold ice water or ice cream. कोल्ड ड्रिंक से आराम मिलेगा. अगर कोल्ड ड्रिंक से आराम मिल रहा है तो क्रियोजोट और दूसरी मेडिसिन लैकेनाइनम हो जाएगी. ठीक है. देयर आर अनदर मेडिसिन व्हिच इज रिलीव्ड बाय कोल्ड ड्रिंक, देयर इज मेंशन, दैट इज मेंशन इन लैकेनाइनम. ओके, तो क्या मैंने बताया कि आइस कोल्ड वाटर के लिए फॉस्फोरस, वैलेरियाना, फॉस्फोरिक एसिड, पल्सटीला and veratrum album is also there. But if I will ask the sensation as if cold on the vertex, a CPI is there, very good, not carbobase. Veratrum album is there, CPI is there, and valeriana is also there. Okay. But suppose if anyone means taking worm into the mouth, then there will be toothache. Which medicine? अगर गर्म पानी अगर मुंह में ले लेता है, toothache as if anything, chamomilla, very good. But if the patient is taking cold ice water, and the toothache complaint will get relief. क्या क्या मेडिसिन है? पल्सटीला, और मेडिसिन और सीपिया, नेटम सल्फ इज ऑल्सो देयर, नॉट कैमोमिला, कैमोमिला में आराम नहीं मिलता है, ठीक है। ब्राइनिया हो गया, कोफिया, पल्सटीला एंड नेट्रम सल्फ हो गया, ठीक है। दीज आर द मेडिसिन वेयर द पेशेंट will get relief in case of toothache while cold holding icy cold water. Okay. Another symptoms, complaints of people who are cold all the time and always feels cold and chilly, lack of animal and vital heat. The wounded parts especially are cold to touch. Means patient is whole chilly, very chilly, and especially where the patient got injured, that portion is very cold. And another symptoms, parts cold to touch but not cold subjectively to the patient. Why? Patient, if the patient is going to touch his injured part but he felt there is no coldness. Why? Because the whole patient is chilly. पूरा पेशेंट खुद ही चिली है, तो उसको क्या क्या पता चलेगा? ही कैन नॉट फील. बट अगर कोई दूसरा पर्सन लाइक हिसके फ्रेंड्स, उसके फ्रेंड्स और उसके फिजिशियन, इफ ही विल टच देन ही विल फेल्ट कि देयर इज अ coolness. लाइक ऑब्जेक्टिव सिम्टम एंड सब्जेक्टिव सिम्टम्स क्या होते हैं? सब्जेक्टिव सिम्टम्स वी कैन कोरिलेट विद द ऑर्गेनन ऑफ मेडिसिन. Those symptom which is felt by the patient, that is known as subjective symptom. But what is objective symptom? Objective symptom means those symptom which is observed by the physician and surrounding friends, that is known as objective symptoms. Another symptoms, in some affection, warmth of bed is intolerable on account of heat and burning of the limbs. Means there are few conditions, means this is the contradictory symptoms of Ledam Pal. There is a only skin condition is there where the patient is having intolerable symptoms and there will be burning in the limbs. Another symptom, swelling of the feet up to the knees, of ankle with unbearable pain when walking. If there is a swelling, if your swelling is there, we can correlate with the practice of medicine. There are few conditions where we will find a swelling of the feet, like if the person is working or standing for the long time, then we will find